I'm Dr. Parijat Kumar. I'm the Director of International Sports and Orthopedic Manual Therapy currently. I'm a physiotherapist. I've done my master's in exercise and sports sciences from Texas, USA. I've done my doctorate also from Arizona, USA. I've done my clinical exercise specialist thing from American College of Sports Medicine, and I'm also a certified spinal manipulative therapist from USA. So I worked and received my education in US for 5 6 years. I worked in US for 5 years, from 2010 till 2016. I was there, and I really learned what are the things and what are the differences. I mean, actually, no, I know better that what are the differences between the Indian setup and the Western medicine and the manual therapy. That's what I'm going to discuss over here. And this is a very general topic, guys. I'm not going to discuss too much into detail as Dr. Himanshu and other speakers did, and they were quite specific and into detail of their topics. I'm going to go very general as what is the evidence-based manual therapy in India versus abroad. Abroad, I will speak more about the US part, but I know about the European part, the African part, the other countries part, because under our organization where International Sports and Orthopedic Manual Therapy, we are also conducting all these labs and webinars where we have students and clinicians from all over the world, a lot of them, and I get to know about what their curriculum and practices are. So moving forward, if I'm sure there are students, I like to define the definition first. I won't take much of the time over here. Uh, so let me move forward. Sorry. All right, there you go. Let me see. I'm going to increase the. First of all, I see the definition of evidence-based. I mean, people still don't know whether, I mean, I'm not expecting much from the students, but I'm sure many of the students also know this, that first of all, we all speak that what is evidence-based. I mean, everybody says that I'm practicing evidence-based. If I ask you what is evidence-based, believe many of you will not be knowing the definition of evidence-based. So if people know, they can mention the answers in the chat. That what exactly do you mean by evidence based? And I come across, I give a lot of feedback and service to the students and clinicians, and many people say that yes, they think they are practicing evidence based, and they're actually, sorry to say, that they are still following the old school of thought in the elementary education. So you need to know what exactly is the evidence based first. So forget about all the doing masters, doing higher studies, doing etc., etc., or studying abroad or here and there. You at your basic level, you need to know what does evidence based mean. Evidence based, as the name suggests, everything around you is all evidence based. You are eating, you are using a toothbrush, you are using a toothpaste, you're using anything. Everything is actually evidence based. There have been lab tests, there have been evidence that yes, this is a material or this is a tool that you can use for. That's why you need to have evidence of whatever you are practicing. So evidence-based, if people know their researchers, that they are the 5 levels of researchers, so you need to know, yes, exactly, the scientifically proven and research-based results. I'm just looking at the chat. So you also need to know what research-based and what is the quality and the level of evidence of that particular thing. Now, say for example, I don't mean to offend any school of thought, but if you ask me that what are the evidences of cupping, level 1, there are 5 level of evidences: level 1, level 2, level 3, systematic reviews, randomized control trials, case expert, case opinion, cohort, and all that stuff. Can somebody please unmute the other person, please, because I don't know whether
yes, I am.
Yeah, because somebody is telling that there's a lot of disturbance during the session. So can you mute, please, if you don't mind? So yeah, evidence-based is you need 5 level of evidences, and I don't see any test or treatment below level 3. If it is level 3 and above, if it is level 1, if it is level 2, or if it is level 3, if it is a randomized control trial, if it is a systematic review, then I go for that test or a diagnosis or that treatment technique. I'm not going to see an expert opinion. Sometimes it works. I'm not going to see any case studies and all that stuff. Sometimes it works too. But I'm going to see the level 1, level 2, level 3 evidences where I can be a better evidence-based manual therapist. Dr. Himanshu and other speakers have been talking about the manual therapy, and that's what you need to understand first, that you are a physiotherapist, a physical therapist. You are a therapist treating physically. So my humble request is try to be a good physical therapist and not depend much on the machines and the electrotherapy. They are required. I understand they have their own importance at their certain points, but try to be a better hand and a manual therapist. That's how you will get your patients' respect and the society's respect. I'll share a small story. I get a lot of calls and messages from students and clinicians, and they tell me, they ask me, so, do we need a council? Why is the salaries of PTs in India so low? And why are we paid so less? My humble answer to this is very simple. I mean, if you are not practicing evidence-based and if you're just practicing electrotherapy on your patients, I'm sorry, the patients might not see that hard work. I'll give you my example. If I'm working on a patient, I'm working mostly on the manual therapy part. So I'm working with my hands on my patient for at least 30, 40, or 60 minutes. My patients see that I'm working hard on my patient with my hands, evidence-based. And then I get that respect, and then I get that consultation or the fees or the salary or whatsoever. But if the patient sees that you are just applying the machines and the modalities, hot packs, cold packs, which are necessary, as I understand, but if you're not practicing manual, the salaries, the revenues, they're not going to go high. All right. So evidence-based, please understand the level of evidence. All right. Manual therapy. There are many aspects of manual therapy. I call physiotherapy as manual therapy too. I haven't used electrical modalities for the last 2-3 years. So I don't use electrotherapy at all. Hands and lifestyle and diet and exercises, motor learning is sufficient enough. Manual therapy includes all these lists that are there. If I miss anything, please pardon me for that. But you need to know that is what physiotherapy is. Mobilizations, manipulations, soft tissue releases, muscle energy techniques, myofascial taping, dry needling, craniosacral therapy, and many more. Understand what is manual therapy. I'm going to discuss some differences in India as well as abroad, and you will understand how come manual therapy is different from here to there. So I won't be taking much of the time on this. All right. So area of differences, what I feel, I mean, I'm not going to compare over here between the Western and the Indian stuff much, because there's no point in kind of comparing things. We should actually understand first within our own country. So number one area of difference that I find is the education. I have come across different university curriculum. I am from Delhi University. I did my undergrad from Delhi University. So the curriculum of Delhi University is different. If I take a university from the South India or from Rajasthan or from Eastern Zone or Western Zone, I see their curriculum is different. So the number one area of difference which has to be regularized, uniform and standardized is your education, the education curriculum. Sometimes it is kind of a funny for me to see that there are students who are studying anatomy and physiology in the second year, and many of us study anatomy and physiology in the first year. Yes, I'm right. So many of the students are also studying anatomy and physiology in the second year. I don't understand that. There should be a set regulation and standardization for the education part. Number two is the clinicals. I don't want to go too much into the councils and associations and all. Clinicals is quite, I mean, the problem is anybody is practicing anything, to be honest with you. I see PTs who are, working as a weight loss specialists. I see PTs who are working in skin beautification and in VLCCs as well. I see PTs who are working in Gold's Gym just for the sake of like a personal trainer or exercises. Try to differentiate yourself. You are a physiotherapist. You are not a personal trainer. You can do better than them. You are not a beautician. You can do better than them. You're a weight loss specialist. You are not a nutritionist. I see many PTs over here. I know that you need to earn your bread and butter, but they are doing these nutrition courses, these yoga. Many people are going to yoga certifications. Totally understand that, and it's very good to do that to increase your knowledge. But please understand, you are a physiotherapist before any other specialty. You cannot be a nutritionist tomorrow, or you cannot be a yoga specialist. You can kind of add, and please refer them to their respective specialist. The area of difference one is the revenue and the CEUs. Revenue, I'll elaborate quickly over here. Revenue, I see the marketing over here, people, I mean, these are the weaknesses and the limitation that I'm discussing, and then we can discuss about the strengths and how to tackle them. I see a lot of clinicians over here, they are actually busy marketing themselves, and including the students. What it means is, say for example, I see some of the students doing a 1-day or a 2-day course, and then they are adding those names in front of them. Say for example, you do a 2-day dry needling course, or you do a 2-day manual therapy course, and then I'm sorry to say they become a certified manual therapist and they become a certified dry needling specialist. That's not true. What you're trying to do is you're trying to market and put names in front of your, try to put suffix in front of your names. That will just market you and attract the patients. Believe patients, they are not going to know what suffixes you have in front of your name. The patient needs to be fixed, bottom line. And in today's world, where the awareness is increasing, the patient wants to be fixed quickly. We do a lot of manipulations here in international sports and orthopedic manual therapy. I'm not saying everybody to start with the manipulations, but manipulations, quick fixations of the patients. We see a lot of sports people, a lot of orthopedic people coming to our clinic and our organization. They want quick fix. You cannot be simply applying electrotherapy and doing exercises and depending upon the doctor's script and the medications for them to get better. Healing will take place, they will get better, but you need to expedite that process as a learned, literate physiotherapist. Talking about the CEUs, which is the continuing education units, which I find quite lacking over here in India, especially as compared to the abroad, to the different countries, because, and the problem is about the licensing and the regulation, because there is no such license over here, so you don't need to maintain your licenses, and that's why you don't do any CEUs, and that's why the many clinicians who are like quite experienced, many doctors who are quite experienced, they are still following the old school of thought. That's why I mentioned evidence-based in the beginning. You just need to not follow the evidence-based, but also the latest evidence. You cannot be following the 1980s or 1990s researchers of doing manual therapy of old school of Mulligan and old school of Syriacs or Maitland. They do work, but there are latest evidences which can fix your patient quickly. All right. So try to engage yourself more in learning and in continuing education rather than just marketing yourself. I'm here just to guide you if I need to, but if you're marketing important as well, for that I would request you to learn before you start marketing, because your patient needs to be fixed. All right. When I say evidence practicing CPGs over here, I mean, few of them good learned experienced clinicians do practice, but when people say that, yes, I'm practicing evidence-based, and if I ask them that, okay, you are using an assessment tool or a treatment tool, what is the rationale or what is the reason for this? All right, just give me a second. Sorry. I guess the internet is working. Yes. Can you hear me? Can you hear me? Hello?
Yes, sir. Yes, sir. We're audible.
Okay. Sorry. All right. Yeah, where were I? All right. Sorry. Yes, I'm going to quickly. Okay. So clinical practice guidelines, guys. Say, for example, I'll give you an example over here. We use a lot of manipulations. We do a lot of manipulations, as I told you. But it's not like I'm not going to impress any patient and the patient is going to come to me, okay, come and I'm going to manipulate you. And yeah, you hear those popping sounds and you are impressed and blah, blah. And I charge them like 2000 or 1000 rupees. No. If I know that my patient has numbness or tingling in the leg, if I know that my patient has hip internal rotation less than 35 degrees, if I know that there are fear avoidance belief questionnaire scores are less, then I'm not going to manipulate them. You need to know all these criteria. These are called clinical practice guidelines or clinical practice criteria, that where to use this assessment technology assessment test, where to use these treatment techniques. Those are called clinical practice guidelines, and these are all evidence based, based upon the latest researches and the scientific proofs, as many of the people said over there in the chat. So try to know these CPG guidelines and then start practicing evidence based manual therapy. All right. Limitations that I see, and it's everywhere. It's not only in India, but in abroad also in other countries. I see a lot of people not practicing really evidence based, and their limitation are in their assessment, the diagnosis, the kind of a diagnosis they are doing, clinical reasoning. Clinical reasoning, patient. I'll give you example over here. Differential diagnosis. Patient coming to you with a neck pain or the upper shoulder pain. The most common thing a student, if I'm asking a student about the assessment, what they do is, okay, they start palpating it. Yes, the upper traps and the levators are quite tender. And then you start putting the hot packs and the ultrasound and massaging and dry needling and blah, blah, etc., etc. What if the patient's blood pressure is high? What if the patient are having gastrointestinal upset? You know that you might say, we know that, I mean, patients can have, but did you ask those questions to your patient? I see a lot of patients, because of this stressful life these days and the white collar jobs and corporate jobs, they're having a lot of stress. They can have anxiety issues, they can have blood pressure issues, they can have gastrointestinal issues. So if you don't ask those questions to your patient and you start putting electrical modalities and just kind of massaging the areas and manipulating it, and believe me, you can help the patient symptomatically, but the root cause would be still there. So that's what we are trying to teach, and that's why these webinars and these Dr. Pradyot, Master Academy, and we at International Sports and Orthopedic, we are trying to teach that please try to assess and treat the root cause of the problem rather than just the symptoms and the pain. The pain is very subjective. I'm not in a good mood. I can have my pain increased, as Dr. Himanshu mentioned about the sins, the severity and the irritability. So the severity and the irritability can increase if I'm not in a good mood. But if I'm in a good mood, I'm traveling abroad, I don't feel my pain. So psychological, a lot of component. Clinical reasoning and differential diagnosis, that's what you need to do and identify those as a limitation. Again and again, I'm focusing on the evidence-based management. Evidence-based management, first you need to diagnose, assess, clinically interpret that, and then start managing, all right? Another reason for why people think that the salaries are too low and why the profession is, what is the comparison is one of the payments that in the other parts of the countries like US and Europe, most of the insurances are paying for their physical therapy or physiotherapy. But in a country like India, 80 or 90% of the people are actually paying out of the pocket. So, and actually believe me guys, out of the pocket is good, because the insurance reimbursement, when I was practicing in US, the insurance reimbursements are quite low. So say for example, I can quote you like an insurance reimbursement over here in India, like CGHS, which is a central government insurance. They pay you according to the modalities, and the amount that they pay you is like peanuts, and believe me, you don't want to hear that. So don't rely on insurances, because in the other countries as well, the market is turning out slowly and slowly into out of pocket things. So people are trying to pay out of the pocket, and that is what is working for the physios over there as well. What is the effect? What are the factors that affect these payments? Obviously, the market influence. What is the market influence? I see, I'm sorry to say, which is market influence and service provided are like the same thing. I see a lot of physios have started adding, names after their name. Suffix like certified osteopath, certified chiropractors, We have a video on our ISOM YouTube channel where I humbly say that, guys, that's not right. You are a physiotherapist. You cannot be a certified chiropractor. You cannot be a certified osteopath. You cannot be a certified manual therapist in 2 days, 5 days, or 10 days. These are like motor learning programs. It is something like I train my friend and he can be a certified physiotherapist in 2 days. Doesn't sound right. And it's not right. So these are different professions. Respect those professions. It's involved in a lot of hours, clinical training. You can learn the concept. You can do the manipulations. As I said in the beginning, I gave my introduction as certified spinal manipulative therapist. I do a lot of manipulations, but I don't call myself as a chiropractor. All right. So you can manipulate over there and you can market. I understand we need to earn our bread and butter, and many patients sometimes ask for these professions that I want a chiropractic session. I tell them honestly that I'm not a chiropractor. I'm a certified spinal manipulative therapist which can perform manipulation. As simple as that. Okay. So please stop writing these suffix in front of your name. As I said, before you market yourself, learn the core values and the strength of those things. Learn how to manipulate, learn those clinical practice guidelines, learn the evidence-based assessment and diagnosis first, and then start using it on your patients. So the service you provide gives you a lot of payment. Like as I said, if you're just putting electrical modalities, your patients say, okay, I might give this person 200, 500, 1000. But if you're asking for like 2000 or 3000 rupees for just applying electrical modalities, believe me, the patient is not going to come for more than 2 times. But if the patient sees you working hard, manually, evidence-based, the patient will come to you. So that's why I said you need to work hard manually, and that too evidence-based. You need to create a patient-friendly environment. As I mentioned over there, you need to be humble. You need to be polite. Those all characteristic of a physiotherapist will come into the picture so that it helps you build up the revenue and your salaries. Salaries and revenues also affect the payment. That's why you start practicing evidence-based manual therapy. As I said at the end option, believe me, your payments, your salary, your revenue, everything is going to go high. Now, students ask me, what is a good school? What is a good school of thought to practice? Dr. Himanshu also said in his lecture that you cannot blindly follow one school of thought. You cannot blindly follow Syriacs. You cannot blindly follow Maitland. You cannot blindly follow Mulligan. You cannot blindly follow one school of thought. You have to be flexible. You have to check your patient's symptoms and signs and then go for it. Clinically do the reasoning. This comes with experience. Do evidence-based, highly sensitive and specific tests on your patients, and then come to a conclusion and then start treating. This takes time. This is a procedure. This is a process, and that's how you learn the assessment and the diagnosis. All right. Almost coming to the end. Evidence-based manual therapy, a combination of the clinical practice guidelines, manual therapy, and experience. How you do it? Please keep on honing your skills and keep studying, continuing education units. In India, we don't have licensing. I understand that you don't need a set requirements, but for yourself, invest in your education, invest in these programs, invest in an evidence-based program. My humble request is, if somebody is making you a manual therapist in 2 days or 5 days or 10 days, he's just making money. I'm sorry to say that. He's just making money. You cannot be a manual therapist in 2 days. You cannot be a dry needling specialist in 2 days. You cannot be a taping specialist in 2 days. You need to study the evidence first. Believe me, we Indians are specialists in actually researching a lot before we spend a single penny. So I don't know why people are not researching the evidence when they sign up for a course like that. Are you really studying the evidence of any XYZ course and signing for it, or you just want to add suffix after your names? Please don't do that. Try to learn whatever things it is, and if it is not evidence-based as well, you can learn, but try to differentiate. Try to use them efficiently on your patients, because you need to fix your patient. You don't need to fix the symptoms, you need to fix the root cause of the patient. As I said, there are courses, webinars, labs like these we keep on doing, Dr. Pradyot has been doing, we have been doing at International Sports and Orthopedic, manual therapy. Manual therapy programs are there. Again, I'm saying do a proper evidence-based, ethical, and economical. Believe me, I have started seeing this pattern that the universities are adding a lot of osteopathic and chiropractic curriculum in the university or the college just to attract students. And when I hear the tuition fees are quite high. I mean, there can be more than 1 or 2 lakhs a year. There are some universities in India that I know that are adding osteopathic modules in their program. But they need to understand we are not osteopaths, we are not chiropractors. We can learn their school of thought, and that has to be evidence based, ethical, and economical as well. All right.